Sleep apnea is a sleeping disorder with loud snoring being the most common symptom that can lead to serious health problems such as high blood pressure and even heart troubles. That is, if not treated in time. Today, let's see what is obstructive sleep apnea, early symptoms, and we will end the video talking about how to treat it early with simple home remedies before complications set in. Now, there are several types of sleep apnea, but the most common one is obstructive sleep apnea. This type of apnea occurs when the throat muscles intermittently relax and blocks your airway during sleep. So, a noticeable sign of obstructive sleep apnea is snoring. Untreated apnea causes breathing to stop repeatedly and suddenly during sleep, causing loud snoring and daytime tiredness, even with full night sleep. So, sleep apnea can affect anyone, but most often older men above 60 who are overweight. Obstructive sleep apnea is a disorder caused by repetitive collapse of your upper airway passage during sleep. It is the most common sleep-related breathing disorder that we see in our practice. So, obstructive sleep apnea occurs when the muscles supporting the soft tissues in your throat, such as your tongue or soft palate, relaxes. This causes your airway passage to narrow or even close momentarily, cutting off your breathing. So, normally, air should flow smoothly from your mouth or nose into the lungs at all times, including sleep. So, periods when breathing stops completely and suddenly are called apnea or apneic episodes. In sleep apnea, the normal flow of air is repeatedly stopped throughout the night. So, the early signs and symptoms of obstructive sleep apnea can be excessive daytime sleepiness, loud snoring, waking up from sleep due to stopped breathing during sleep, abrupt awakenings accompanied by gasping and even feel of choking, awakening with dry mouth or sore throat, morning headaches, difficulty concentrating during the day, even mood changes, depression, or getting angry continuously, high blood pressure, and decreased sexual health. If it's not treated in time, sleep apnea causes a number of health problems, including high blood pressure, stroke, enlargement of your heart, heart failure, diabetes, and heart attacks. So there are majorly two types of sleep apnea, obstructive and central. Let's see both of them now. So obstructive sleep apnea is the most common of the two. It occurs as the repetitive episodes of complete or partial upper airway blockage during sleep. But in central sleep apnea, the airway is not blocked, but the brain fails to signal the muscles to breathe due to instability in your respiratory control center in the brain. So it's a brain related illness. In mild cases of obstructive sleep apnea, lifestyle changes can be enough, like in overweight people, simply losing weight. There are medical treatments like continuous positive airway pressure therapy and use of small machines like bilevel positive airway pressure. In some cases, home remedies and simple lifestyle changes can help with obstructive sleep apnea. So, lose excess weight. Even 10% weight loss might help relieve constriction of your throat. In some cases, sleep apnea can resolve if you return to a healthy weight, but it can reoccur if you regain that weight. Next is exercise. Regular exercise can help ease the symptoms of obstructive sleep apnea even without weight loss. So try to get 20 minutes of moderate activity like fast walking every day. Avoid alcohol and certain medications such as tranquilizers, sleeping pills. This relaxes the muscles in your back of your throat, interfering with regular breathing at night. Sleep on your side or abdomen rather than on your back, because sleeping on your back can cause your tongue and soft palate to rest against the back of your throat and block your breathing. So don't smoke. If you're a smoker, it would be good if you quit smoking as soon as possible. And lastly, if nothing is helping and still you are getting episodes of sudden choking or awakening at night, even tiredness in the daytime due to sleep disturbance, you should meet our specialist for our specially formulated Cure Plus homeopathic treatment for sleep apnea. That's all in today's episode. See you all in my next episode of Dr. Welling's Health Show. This is Dr. Saurabh Welling signing off. Bye and take care.